Founded in 1999, South Texas Radiology Imaging Centers is the largest provider of outpatient imaging and interventional services in South Texas. With over 70 radiologists and 22 locations, South Texas Radiology Group is celebrating 20 years of screening, diagnosing, and treating millions of patients in our community. Our physicians specialize in pain management and offer an array of services which focus on getting you back to good health and resuming regular activities. STRIC offers pain management services at 3 convenient locations. Get ready to meet 4 of our highly trained physicians that offer interventional pain management that focuses on eliminating back pain.
My name is Lance Reinsmith. I'm an orthopedic radiologist at STRIC. I specialize in orthopedic radiology and interventional pain management. I'm originally from Houston, Texas. I went to undergraduate at the University of Texas at Austin, and then stayed in Texas for medical school at the Baylor College of Medicine. I then did my postgraduate training at the Mallinckrodt Institute of Radiology in St. Louis, Missouri. There I specialized in orthopedic radiology and interventional pain management.
My name's Cade McDowell. I'm originally from Killeen, Texas. I'm a radiologist at STRIC. I'm married and I have 2 children, one age 15, the other 18. I did my medical school at UT Houston in the Texas Medical Center. I did my residency in St. Louis at Mallinckrodt Institute of Radiology. I also did my fellowship there where I got extra training in MSK, MRI interpretation, and also doing procedures, including pain procedures.
My name is Dr. Stephen Lau, and I am a radiologist at STRIC. I am one of the musculoskeletal and pain and interventional management doctors here.
I'm originally from Louisiana, born and raised out of New Orleans. I am married, I have no children. My hobbies include hanging out with my wife and seeing the great outdoors of San Antonio. So I started my medical journey at the Louisiana State University for medical school. I then did a diagnostic radiology residency at Baylor in Houston. And then I did a focused fellowship in musculoskeletal radiology and pain management at the Massachusetts General Hospital in Boston, Massachusetts.
Okay, so my name is Jack Clement. I'm an orthopedic radiologist with South Texas Radiology Imaging Centers. I'm originally from New Orleans, but I also grew up in Houston, Texas, and Midland, Texas as well. I've been in San Antonio now for 14 years as a practicing interventional pain management specialist and musculoskeletal radiologist. I have 1 wife, I have 4 children, a couple of dogs, several cats, and even a few chickens. After my undergraduate years, I went to medical school at Baylor College of Medicine in Houston, Texas. I actually enrolled in a dual degree program where you pursue both a medical degree and a graduate degree sort of simultaneously. So I received both MDs and PhDs from there, and then spent 5 years doing a diagnostic radiology residency as well at Baylor College of Medicine in Houston. From there, I went to Boston for 1 year where I completed a fellowship in interventional pain management and musculoskeletal radiology. And from there, came here and started my practice with STRIC. At STRIC, we offer a full complement of interventional pain procedures, all image guided, to help with back pain. That can be neck pain, low back pain, mid-back pain. It can be pain from arthritis. It can be pain from fractures. It can be pain from herniated discs. If you have pain that is not getting better with just over-the-counter oral anti-inflammatories, and that's persisting, and that is starting to limit your activities of daily living, you are a candidate for an interventional-based spine procedure that can help you get rid of your pain and prevent you from needing surgery.
General candidates for therapeutic spine injection are people in pain. It's especially helpful if we have imaging beforehand that'll help us sort the source of the pain. Then we can do a targeted injection in that area.
So we offer many different types of spine injections, the most common usually being the epidural steroid injections. However, depending on what structural abnormality the patient is experiencing or what kind of symptoms the patients are experiencing, we may elect to do nerve blocks or even facet joint injections.
If we know there's one problematic area, particularly a problematic nerve that is being irritated, we could do a more focused injection right over that area.
As a radiologist, a large part of my job is looking at diagnostic imaging studies of the spine and other parts of the body. As a result, my colleagues and I are very familiar with the spinal anatomy, and that helps us when we're doing procedures to understand the nuances of the structure of the spine. A knowledge of the spinal anatomy also helps us communicate better with the patients and show them pictures and allow them to understand what's causing their symptoms and how we're going to try to alleviate those symptoms.
As a radiologist, our skill is in diagnosing on imaging where we think the pain is coming from, where you have disc herniations, where you have active arthritis. And as an interventional spine specialist, our job is to put that imaging together with your clinical description in order to give us the best likelihood of getting medication where it's needed in order to provide you pain relief.
Typically, we inject two different types of medications with our typical spinal injections. One is a certain steroid, which usually provides anti-inflammatory properties, and the other is an anesthetic, which numbs the nerves.
Our injection first consists of a small amount of contrast material to help us know that we're in the right spot. After that, we inject a combination of anesthetic and steroid. The anesthetic generally provides immediate relief. The steroid takes at least a day or two to kick in, but that gives a more long-term relief.
We see patients in our practice with specific orders from the referring clinician, but we can also talk with patients in consultation to determine what's the best course of therapy.
Insurance usually does cover these procedures, particularly when there is a known diagnosis and a known area where we can treat.
We accept most major insurance carriers and will work with your insurer to see how your benefits will cover the procedure.
For most of our patients, we do request a driver. Sometimes there may be associated numbness after the procedure, so we do like to have a driver just to be on the safe side.
Most of our procedures require no sedation and only require you stopping some medications prior to the procedure. Other procedures will require sedation and will require you to not eat for at least 6 hours prior to the procedure, as well as discontinuing some medications.
The injection itself takes a very short time, a matter of 3 to 5 minutes.
That being said, the whole experience of coming in and getting checked in and being clinically reviewed and talked to probably takes anywhere from 15 to 30 minutes, depending on how complex your problems are.
Many of our patients experience slight discomfort during the procedure, but it's my belief that the long-lasting effects far outweigh the slight discomfort during the injection.
So typically after these spinal injections, we do not limit the patient's activity. However, if the patient does have an order to undergo physical therapy or exercise, we typically tell them to remain inactive for about 24 to 48 hours.
After the first injection, if the patient's symptoms begin returning, we could repeat the injection in 10 to 14 days. This gives kind of a booster response, and most patients have even better relief after the second injection.
So once we've consulted with you and given you injection, we like to see you back in about 10 to 14 days. And that's to give time for the steroids to work. It often takes 7-10 days for the steroids to really ramp up and have their anti-inflammatory effect and start to treat the pain that you've had. If you're 70-80% better, there's often no need for a second injection. But if you're only halfway better, or if it got really better but then wore off pretty quickly, then we often do a second injection 2 weeks apart and maybe even a third injection 2 weeks after that. Once that's happened, we put patients into a little bit more of a maintenance phase where they can get injections every 3 to 4 months as needed if they have chronic pain and haven't gotten better by ultimately healing this thing themselves.
The steroid medicine we inject for most procedures is active in your body for about 2 weeks, but the effects of it can be much longer lasting than that. We usually take each patient one step at a time and determine if any further injections or other therapies are necessary.
These procedures are currently available to be performed at 3 convenient locations. To schedule with one of our board-certified specialty physicians, call 210-617-9070. Thank you for choosing STRIC.
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 Thank you for using STRIC, your partner in patient care.
Your partner in patient care.
Talk to your physician about the procedure that's right for you.